Hi everyone, welcome to our channel. I am Dr. Amit Goswami. I am a laparoscopic and bariatric surgeon practicing in Gurugram over 2 decades of experience. And today we are talking about hiatal hernia, a condition that many people have but don't even realize. It can cause discomfort, digestive issues, and even breathing problems. So how can you tell if you have one? And when is the surgery the best option? Let's dive in. Before we get started, don't forget to like, share, and subscribe to the channel for more informative videos on health and surgery. So what is a hiatal hernia? Before going deep, let us discuss what is hiatus. Hiatus means an opening. So as we know, diaphragm separates chest from abdomen, and the food pipe enters in the abdomen from chest through a orifice in diaphragm. So when the stomach goes up in the chest through this orifice, it causes hiatus hernia. Normally the stomach stays below it, but when it happens when in some cases the opening become too wide, letting the stomach to slide up. There are two main types: sliding and paraesophageal. Paraesophageal was the rare one. Sliding hernia is common. In sliding hiatal hernia, the stomach moves up and down through the diaphragm. Whereas in paraesophageal hernia, part of the stomach gets stuck above the diaphragm, which can cut off the blood supply too. So how can you identify a hiatal hernia? So you can have multiple symptoms. Reflux, you get acid fluid coming into your mouth. You can feel sourness in your mouth or pain abdomen. Regurgitation is the undigested food matter came back again to your mouth. So the common symptoms of hiatal hernia is frequent heartburn, especially after eating or lying down. You can also have difficulty in swallowing. It feels like food is not going down. You can have chest pain or discomfort. Often it is mistaken for heart problems. You can have shortness of breath, especially if the stomach is pressing against the lungs. Or in very rare cases, you can have chronic cough or hoarseness. If you have persistent symptoms, don't ignore them. It is important to see the doctor for proper diagnosis, which might include some specific investigations like upper gastrointestinal endoscopy, barium swallow X-ray, or even esophageal manometry. So when does a hiatal hernia need surgery? It also depends on the age, but most small hiatal hernia don't require surgery and can be managed with lifestyle changes and medications, like for example pantoprazole, esomeprazole, ranitidine, etc., or eating smaller meals, avoiding acidic or highly spicy food. You should have a minimum of 1.5 to 2 hours before gap from having dinner and lying down. And you need to lose weight if you are overweight. However, surgery is recommended if the hernia is large and causing severe symptoms. You have chronic reflux that doesn't improve with initial medications, or the hernia is late, it is already complicated. So what is the surgical treatment of hiatal hernia? The gold standard of treating hiatal hernia surgically is laparoscopic repair. The repair is called laparoscopic Nissen fundoplication. So here how it works. It is a minimally invasive procedure done through 4 or 5 small incisions. The stomach is pulled back into its original place. The hiatus, that the gap, is tightened with sutures, or upper part of the stomach, surgically it is called fundus, is wrapped around the lower esophagus, and it helps in creating a valve-like structure that prevents acid reflux. Recovery is faster than the open surgery. Patients usually go home within 1 to 2 days and resume normal activities in a couple of weeks. If you experience symptoms of a hiatal hernia, don't ignore them. Early diagnosis and treatment can make a huge difference. If you found this video helpful, hit the like button, share with your friends, and subscribe for more insights into surgical conditions. Got questions? Please feel free to drop them in the comments below. I would like to answer them. Thank you.